Hi, I'm Gina Murray, the director and co-owner of Aware Senior Care. For today's Tuesday tip, I'll be talking about strokes. What is a stroke? And in the event of a stroke, what should you do? You may have heard the term stroke called by its medical term, Cerebrovascular Accident, or CVA. So what is a stroke? Simply put, a stroke is a brain attack. It occurs when a blood vessel either is blocked or bursts in the brain. When a stroke happens, an area of the brain may not get the necessary blood supply it needs, and the brain cells die. Depending on the area of the brain that was affected, the person's ability to speak, see, or move may become impaired. When I thought about strokes, I assumed that they were things that happened primarily to seniors. I was surprised to learn that strokes can happen to anyone, at any age, at any time. 1 out of 5 people who have a stroke are under the age of 55. There are nearly 7 million stroke survivors in the U.S. It's the 5th leading cause of death in our country. In fact, more women die from strokes each year than from breast cancer. There are ways to lower your risk of having a stroke. Keep medical conditions under control, such as high blood pressure, atrial fibrillation, high cholesterol, and diabetes. Maintaining a healthy weight and avoiding smoking will also help. There are risk factors which we can't control, such as gender, race, age, and a family history. Many people know the acronym FAST for the signs of a stroke: facial droop, arm weakness, speech difficulty, time to call 911. There are other signs to look for, and knowing all 10 signs may save yourself or someone you love. Confusion. You may see them look puzzled, have a hard time focusing, difficulty understanding. They may raise their eyebrows, shake their heads. Dizziness. You may see unsteady movements, like they're drunk but they haven't had any alcohol. A loss of balance. They may wobble around, grab onto a stationary object. Numbness. They're constantly touching or massaging or shaking the numb area. Severe headache. Touching their head, rubbing their temples, sensitivity to light. They may have trouble speaking. Sentences aren't understood. They have difficulty having a conversation. Trouble walking. You may notice them tripping over nothing. Visual changes. Squinting, rubbing their eyes, not being able to read. An overall weakness. The person just wants to sit down or lie down. They have difficulty doing simple tasks. If you notice any of these, it's essential to call 911 immediately. In fact, it's okay to overreact if you suspect a stroke. For more information, visit the link to our website in the description below. We hope today's Tuesday tip was helpful. Subscribe to our YouTube channel for future Tuesday tips and like our Facebook page for more helpful senior care content. Thanks for tuning in.